Today we're going to look at the basics of the Medicare program. I'll go through all the different parts and components of Medicare, and then we'll also look at the two types of plans that are designed to work with Medicare, which are Medicare Advantage and Medicare Supplement. Hi, I'm Trey Jones, and I work with folks all across the country to help them understand Medicare and then find the Medicare product best suited to their individual needs. So we're going to jump right in here, and the first thing that we're going to look at is, how do you get enrolled in Medicare? Well, you have two options. Option one, if you are drawing Social Security benefits before turning 65, then you'll automatically be enrolled in Medicare. You will not have to do anything, and in this scenario, you will receive your Medicare card from the Department of Health and Human Services roughly 3 months before the month you turn 65. For example, if you turn 65 in June, then you will receive your Medicare card in the first part of March. Option two, you are not yet drawing Social Security by the time you turn 65, which is fine considering the full retirement age is not until a little bit later. In this scenario, you will actually have to enroll yourself. Very easy to do. To enroll in Medicare, contact Social Security. You'll go through the Social Security Administration. You can either complete the paper application and return it to your local Social Security office, or you can use the online enrollment platform found on Social Security's website, which is ssa.gov. And I will link on the screen here a video showing you in depth how to enroll yourself in Medicare. Now that we know how to enroll in Medicare, let's take a look at what your basic federally provided Medicare benefits are. There are two parts, Part A and Part B. Quick note, these are the only two parts of Medicare entirely managed and provided to you by the federal Medicare program. Everything else, every other part or component of the Medicare program is private insurance, and as such, it will be marketed and sold to you by a private insurance company. Parts A and B are provided by the federal Medicare program, and you will generally become eligible for Medicare, Parts A and B of Medicare, when you turn 65, just by virtue of having paid taxes your entire working life. So let's take a little closer look, starting with Part A, which is called your hospital coverage. Probably should be referred to as your inpatient hospital coverage, because you do actually have to be an inpatient in a hospital in order for Part A of Medicare to be billed on your behalf. The rule for Part A says that as long as you, or in some cases a spouse, has worked at least 40 quarters, which is 10 years, and you pay the appropriate taxes during that time, then you will qualify at age 65 for premium-free Part A. So if you're watching this and you've worked at least 10 years and you paid your taxes during that time, you can write down a 0 beside Part A. Should not cost you anything. You will not pay a premium for Part A. And the first out-of-pocket requirement under Part A of Medicare is the deductible. Part A has a $1,484 per benefit period deductible. So it's not an annual deductible. This deductible has to be met per 60-day hospital benefit period, meaning you could very well be asked to meet this deductible more than once during the course of a year. A few of the other out-of-pocket requirements or coverage gaps under Part A of Medicare kick in after you've been in the hospital for 60 days. On day 61, you are going to have a responsibility of $371 per day. If you're in the hospital longer than 90 days, on day 91, you're going to have an out-of-pocket requirement of $742 per day. Part B is called your medical coverage, and you can think of this as your outpatient coverage. Part B of Medicare is going to cover things like visits to your doctor or any specialty doctors you see. It's also going to cover any durable medical equipment or outpatient procedures you have to have done. So more or less anything outside the hospital. Now, Part B is going to require that you pay a monthly premium. Right now, the standard monthly premium for Part B is $148.50, although if you're considered a high-income individual, you may be asked to pay more. I'm going to put on the screen here a chart of the income thresholds and their corresponding Part B premiums. And I'll include a link in the description to the Medicare page so you can go and find the updated information whenever you happen to be watching this video. Part B has an annual deductible, which is currently $203. This means you're going to be asked to come out of your pocket and pay the first $203 worth of medical expenses during the course of a year. After you've met that deductible, you have a 20% out-of-pocket requirement for the rest of the year. Anytime your out-of-pocket requirement is expressed as a percentage, it can get very high very quickly, and there is no cap here. This is why most people of their own free will and volition will choose to use something with Medicare. Everyone we work with here in this office is either already on a fixed income or they will be in the not too distant future. And what they do not want to have to worry about are high, unpredictable out-of-pocket costs relative to their health care, especially in retirement, which is when statistically you will begin using your health care more frequently than you may have done before. And you have two options here in terms of plan types that you can use to mitigate your exposure to the high out-of-pocket costs in Parts A and B of Medicare. One is called Medicare Advantage, the other is called Medicare Supplement. Now, they're very different programs in how they work with Medicare, and you cannot have them both. So now we're going to go through these programs so you understand how they work, what they cost, and what the implications will be on your Medicare benefits if you enroll in either one. I'm going to start with Medicare Advantage. Now, the Medicare Advantage plans are very easy to recognize. Anytime you see any type of provider network referenced, like an HMO or a PPO, you know you're looking at Medicare Advantage. So these are going to be your network-based plans. When you enroll in a Medicare Advantage plan, your relationship with the federal Medicare program is going to change a little bit. Specifically, Medicare will no longer provide you directly with your Medicare benefits. Instead, Medicare will pay your Medicare Advantage plan a set monthly dollar amount. In exchange for that monthly payment from Medicare, your new Medicare Advantage plan becomes responsible for providing you with your Medicare benefits. So if you enroll in a Medicare Advantage plan, you will get your Medicare benefits from the Medicare Advantage plan, not Medicare, although you do have to continue paying your Part B monthly premium. So because the Medicare Advantage plan is the entity that provides you with your Medicare benefits now, they get to tell you what your share of the cost is. So your Medicare Advantage plan will tell you what your copay is at a doctor or a specialist. They're also going to tell you what your co-insurance percentage requirement will be at a hospital, or if you have some type of outpatient surgery, etc. So the Medicare Advantage plan is in complete control of administering your Medicare benefits. Now, the amount of money that the federal Medicare program pays your Medicare Advantage plan every month is not random. It's based on a Medicare beneficiary capitation rate. Medicare tracks its costs very closely, and so they know for every county, really, what an average Medicare beneficiary should cost them per month. It's usually around $1,200. So every month that you are enrolled in a Medicare Advantage plan, that Medicare Advantage plan, that insurance company, is going to be paid roughly $1,200 by the federal Medicare program on your behalf. So, and that doesn't matter if you use your health care or not. Even if you don't go to the doctor, if you don't use the coverage, they're still going to get that $1,200 monthly payment from Medicare. Now, the insurance companies that sell the Medicare Advantage plans are in business to do one thing and only one thing, and you probably know what that is. It's make money. They're in business to turn a profit. So to do that, they have to keep enough of that monthly payment from Medicare to be profitable. One of the main ways that they're going to go about achieving this is by requiring that you only see doctors and hospitals and providers with whom they have a favorable cost agreement worked out. This is where you get your provider networks, your HMO, your PPO, whatever it is. So when you see the commercial on TV, it says this is a $0 plan, it's free, free, free. They're conveniently forgetting to tell you that they're receiving $1,200 of the tax equity you paid into the Medicare program throughout your working life. They're receiving that every month. Just a couple last details about these plans. They will usually roll in coverage for your prescription drugs. So you only have to have one plan that covers your health care and your prescription drugs. And they are allowed to include some ancillary benefits like dental or vision or gym memberships or whatever. The ancillary benefits that are included by the Medicare Advantage plans are different with every plan in every county, and they change every year. So that's Medicare Advantage. It's It's the right fit for some folks. Your other option is called Medicare Supplement, or sometimes you'll hear these plans referred to as Medigap plans. And these are your lettered plans, like Plan G, Plan N, Plan F, etc. And there are a couple big differences right off the bat with the Medicare Supplement plans. The first being, and this is probably the biggest driver to these plans, there are no network restrictions. You can see any doctor or specialist or hospital. You can see any provider in this country, the only qualifier being they have to accept Medicare, which thankfully the overwhelming majority of providers nationwide do accept Medicare. You can see any of them. You don't need a referral. You don't need anyone's permission. So that's the first difference with these plans. Secondly, the Medicare Supplement plans are standardized. All that really means is that the insurance companies have zero input or decision-making privileges with regard to what's covered or plan design. The Medicare Supplement plans are designed and standardized by the federal Medicare program. Now, you'll buy these plans from an insurance company, but the insurance company cannot change the plan at all. In most markets, there are usually 50 or 60 different insurance companies that will sell any given Medicare Supplement plan. So we'll use Plan G, for example. So if there are 50 insurance companies that will offer to sell you a Plan G, every single one of those plans is identically the same product. The only difference, the only thing the insurance carrier has any control over is the price. And so in most markets across the country, we see 50 or 60 different insurance companies selling the same standardized plan for a vast disparity in price. Now, the two plans that everybody is going to offer in most parts of the country, there are some exceptions here, New York, some other states, but in most areas in the country, plans G and N are the most common and the most popular plans. And because of that, that's what we're going to go through here. I'm going to start with Plan G because it's for most people, especially if you're new to Medicare, Plan G is going to be your most comprehensive option. So the way Plan G works, first, there are no networks. You can see any doctor you want to as long as they accept Medicare. You'll pay your monthly premium directly to the insurance carrier, after which your only out-of-pocket requirement is the annual $203 deductible. So from your perspective, what this looks like is you have to pay the first $203 worth of healthcare expenses. After you've done that, all the other coverage gaps in Medicare are covered. So you have a $203 annual deductible, and then you're done. Now, to be really clear by what I mean by done, that means when you go to a doctor after having met the deductible, you don't have a copay. Same thing at a specialist, no copay. If you have to go into the hospital or have some type of surgical procedure done, if you've met that $203 deductible, your out-of-pocket is nothing. So Plan G is very, very comprehensive. Now, the other option is Plan N, as in November. Now, Plan N over the past two and a half years has experienced a real surge in popularity. And the reason for that is the monthly premiums are lower, and they're going to follow a flatter trend line. In other words, they're going to stay lower longer. The trade-off is you can be asked to come out of pocket with a little bit more money at the point of service. So here's how Plan N works. Similarly to Plan G, there are no networks. Plan N will always carry the same annual deductible as Plan G. It's currently $203. Now, with Plan G, after you've met that deductible, you're done. With Plan N, after meeting that $203 deductible, it's a little bit different. You can still be asked to come out of pocket with up to $20 when you go in for a doctor's office visit. Now, there's no distinction drawn here between a primary care doctor and a specialist. It's just a $20 payment limit at a doctor's office. The doctor may charge you nothing. He or she may charge you $10 or $15. They just can't go over $20. That's the first difference with Plan N. The second difference is, God forbid something happened and you have to go into an emergency room. They are allowed to charge you up to $50. Now, as you may know, emergency care is very, very expensive, so they will charge you that $50. 2 aspirin will cost $50 in an emergency room. So that's the second difference. The last difference is really one of the reasons that Plan N has gotten so popular so quickly, is because everyone is now realizing that the last difference is very, very rare. And that is that Plan N does not cover something called Part B excess charges. So Plan N does not cover Part B excess charges. Let me explain what on earth that means. So any doctor that wants to provide his or her services to Medicare beneficiaries is first required to have a contract with the federal Medicare program. And they have two contracting options available to them. The first contracting option, the doctor is going to accept Medicare and also accept something called Medicare assignment. And in that scenario, the doctor agrees to allow the federal Medicare program to tell them what they should charge for their service in their market. And if the doctor agrees to this, the federal Medicare program will actually tack on an extra 5% to the amount they pay that doctor for their service. So there's a little bit of financial incentive here. This is how the majority of providers work with Medicare. Okay, in this scenario, there are no excess charges. So that's contracting option one. Contracting option two is where the doctor will accept Medicare, but refuse to accept Medicare's assignment. Now, in this scenario, the doctor is immediately paid 5% less for their service than their peers in their market, but they're allowed to charge you a percentage beyond what Medicare would pay them for their service. And that's capped at 15%. Now, this is extremely rare. And Medicare, on their public-facing website, Medicare.gov, has a provider lookup tool, which is essentially just a searchable database. Every doctor who has a contract with Medicare also has a details page, a listing page in this searchable database on Medicare's website. And so right under their name, that one of the very first details you see is how they accept Medicare. So in my office, we have just added a very quick, easy step to our due diligence process. Before I write anyone a Plan in, I look your doctors up. It takes approximately 15 seconds. It's very easy to do. So that's how Plan N works. A few other details about Medicare Supplement plans that are important. First, these plans are allowed to underwrite you for health. And if they believe that you are too high of a risk, they do not have to enroll you. This is very, very important. So you are going to be given a 6-month window that you will only get once in your life. The reason that 6-month time frame is so important is because during that time, no insurance company that would sell you a Medicare Supplement plan can look at your health. They have to accept you, and they have to give you their most competitive rate in your market. Okay, and then once the 6-month window is over, they can never drop you unless you don't pay your monthly premium. So every Medicare Supplement plan is required to be what's called guaranteed renewable, and all that means is they can never drop you unless you do not pay your monthly premium. That is Medicare Supplement in a nutshell. The last thing that we'll go through is coverage for your prescription drug. Now, this is Part D of Medicare. Now, there are two ways that you can buy prescription drug coverage. Option one, if you buy a Medicare Advantage plan, it will almost always roll in coverage for your prescription drugs. Option two, if you keep original Medicare and buy a Medicare Supplement plan, then you will need to buy a separate, smaller, standalone prescription drug plan. Now, the easiest way to find your drug coverage is to use the Plan Finder tool on Medicare's website. It is very, very simple, and it's the most objective way to find your drug coverage. You'll need to enter your prescriptions, including the dosage strength and the frequency with which you take that drug, for example, once a day, twice a day, whatever it is. And then it will, based on your zip code, allow you to select the actual physical pharmacy location where you are driving to buy your drugs. And then based on that information, it's going to give you a list of every drug plan available for you to buy in your market. And it puts that list in order, starting with the drug plan that is expected to give you the lowest annual retail cost for your drugs. And so that is just a really easy tool to use. That's something that we usually do for all of our clients. Now, I know I've given you a lot of information pretty quickly. We do help folks across the country with Medicare. We help them find and enroll in the Medicare product that is best suited to their needs, and our service is completely free to you. If you need help or someone you know needs help, feel free to reach out to me. My office number is going to be on the screen, or you can go to my website, and I'll put a link in the description here. But the website is www.navigatemedicare.org, and you can just use the contact form there. We don't ever sell your information. If I can help you, feel free to reach out to me. I hope the information in this video has helped you. If it has, please like the video and consider subscribing so you don't miss any of our new videos. And I hope you have a great day. Thanks so much. Bye-bye.